It's that feeling we all know, right? That little tickle in your throat, maybe you're suddenly just exhausted. You know something's coming on, but what is it? We're going to dive right in and clear up one of the most common health questions there is.
And your brain immediately starts running through that checklist. Do I have a fever? Are my muscles aching? Seriously, knowing the answer can make a huge difference in how you handle the next few days. So, how can you actually tell?
So here's what we're going to cover. First, we'll figure out if it's the flu or just a cold by meeting the culprits. Then, we'll get into the key differences. After that, we'll talk about your best defense, prevention. We'll also go through a self-care playbook for when you do get sick. And finally, and this is super important, when to call a doctor.
All right, to really get this, we got to go a little deeper and meet the actual culprits, the viruses themselves. You might be surprised that even though they can feel pretty similar, they come from totally different viral families.
So first up, we've got the flu. This thing is caused by specific viruses, influenza A or B. Think of it like a specialist, a targeted attacker that shows up seasonally. That's why we have a flu season every single winter.
Now the common cold, it's a whole different ballgame. It's not caused by just one virus. We're talking about any one of over 300 different types. And that massive variety is exactly why you can catch a cold pretty much any time of year.
All right, now for the main event, the symptom showdown. You're feeling crummy and you just want to know what you're dealing with. So let's put these two side by side and find those telltale signs.
Okay, here's maybe the biggest clue right off the bat. If you're running a fever, especially a high one that seems to come out of nowhere, that is a very strong sign that you're dealing with the flu, not just a run-of-the-mill cold.
And this really gets to the heart of how they feel. The flu, on the left here, it hits you like a truck. It's sudden, it's intense, it's a full-body thing with high fevers, chills, and major aches. A cold, on the other hand, usually just creeps up on you. It starts gradually, and the symptoms are more in your head. You know, a stuffy nose, scratchy throat, sneezing. It's annoying, for sure, but it's not a total system shutdown like the flu.
Okay, so knowing what you're up against is great. But you know what's even better? Not getting sick in the first place. So let's talk about prevention and how you can build up your defenses to stay healthy.
Let's start with the single most powerful tool we have against the flu, the vaccine. Getting that yearly flu shot can slash your risk of getting sick by a whopping 60 to 80%. And hey, even if you do still get the flu, being vaccinated usually means your illness will be way less severe. Now, the vaccine is a good idea for pretty much everyone, but for some folks, it's absolutely critical. People with chronic conditions, the very young and the elderly, pregnant women, and our amazing healthcare workers, they're all at a higher risk for serious complications if they get the flu. And look, beyond the vaccine, it really comes down to these simple but super powerful daily habits. Washing your hands often is your #1 defense against cold viruses. Covering your coughs and sneezes stops the spread. And yeah, that yearly flu shot we just talked about, that's what completes your prevention toolkit.
All right, so what happens if, despite all your best efforts, you get sick anyway? It happens to the best of us. Don't worry, there's a pretty clear playbook for taking care of yourself at home and getting back on your feet fast.
Okay, first things first, and this is a big one. We need to bust a common myth. Reaching for antibiotics is not going to work. The flu and the common cold are caused by viruses, but antibiotics are designed to fight bacteria. They're just not the right tool for the job here.
So, what actually works? It's all about making yourself comfortable and giving your immune system the support it needs. That means lots and lots of rest. You want to drink tons of fluids, like 3 to 4 liters a day to stay hydrated. Over-the-counter meds are your friend for aches and fever, and a simple warm saltwater gargle can do wonders for a sore throat. And please, do not smoke. It'll just make things worse.
Now, most of the time, you can definitely ride out a cold or flu at home. But, sometimes they can turn into something more serious, like a secondary infection. So it is crucial to know the warning signs that mean it's time to get a professional opinion. So that's the big question, right? You've been doing all the right things. You're resting, you're drinking water, but you're just not getting any better. How do you know when it's time to stop waiting it out and actually call your doctor? Okay, here are the key red flags to look out for. A fever that just won't break after 3 or 4 days. Any kind of painful breathing, wheezing, or shortness of breath, that's a big one. Or a cough that just hangs around for weeks. Other signs like ear pain, pain around your eyes, or frankly just not feeling any better after a week or so, that could mean something else is going on, like a bacterial infection that actually needs treatment.
So when you boil it all down, what's the big takeaway here? Well, knowing the difference between a cold and the flu is really useful when you're sick,
But the real power is in prevention. Your best strategy for cold and flu season doesn't start with that first cough. It starts right now. After all, the best way to fight an illness is to never get it in the first place.
Don't forget to subscribe for more health tips and updates.